Hi, I'm Julie and I'm one of the nurses with the Solent NHS cardiac rehab team. So during our rehab programme, one of the topics we discuss with you is stress and how to manage it. So we'll be discussing this topic in this video and looking at really why considering our mental health and well-being is as important as the physical. So let's start by defining what we mean by stress. So stress occurs when we feel under threat or danger or under pressure. And when we feel under threat, our bodies all respond in the same way by releasing certain hormones to help us cope with the situation. And this is termed the fight or flight response. So in the short term, fight or flight can be very useful to us to help us cope with these situations. And a small amount of stress isn't always a bad thing. So it can help motivate us, it can help us to focus and to achieve goals. But when this stress continues longer term, it can start to have a detrimental effect on our health. And some of the ways in which our body responds as part of fight or flight can also be detrimental to us longer term. So particularly thinking about the heart in this situation, one of the hormones that is released is adrenaline. This will increase our heart rate and our blood pressure and therefore put strain on the heart. Cholesterol will also be released as fats and sugars are released into the bloodstream in higher quantities. And we may also become more liable to form blood clots as our body actually prepares itself for injury. So all of these things are things that we particularly want to avoid if we've got a history of heart disease. Now, it's not only your body's fight or flight response that may be harmful to us, but also when we are in times of stress, it's the ways in which our behaviours and our habits may change, which can also increase our heart disease risk. And we'll discuss this a little bit further later on. So what can cause stress? Well, common causes include financial reasons, work, family and relationships, loneliness, major life events and change. And if you've been in hospital recently with a new health diagnosis, you've been through a major life event and you may well be looking at ways in which to change certain aspects of your life. And this can be difficult for you and your loved ones. Now, everybody copes with heart disease and with a new diagnosis differently. Some people take it in their stride, and for others, they can find it quite overwhelming and can feel quite tearful. And this is quite normal. So you might find if you're feeling low and anxious that you have up and down days for a period of time afterwards. But if this does continue or you start to feel unable to cope with these feelings, that's the time to get in touch and talk to your GP. And it is important to say that stress isn't the only cause of depression and mental health problems, but we do know that there is a clear link between long-term stress and conditions such as anxiety and depression. So I'm going to talk now about how to recognise stress. It is helpful to be able to recognise when stress may be starting to overwhelm us. If we can spot some of these early warning signs, we may be able to prevent it from developing further. So what are these signs? Well, thinking firstly about physical signs of stress, these include muscular aches and pains, headaches, particularly that sort of tension headache that can occur at the front of the head there. Sleep disturbance is very common. You may experience a loss or change in your sex drive, and you may also experience a change in your appetite or your eating patterns. With regards to appetite, it's important to say that can go in either direction. So you might find that you lose your appetite altogether when you're stressed, or you might find that it's going the other way and you're actually overeating or comfort eating. You're likely to also find that habits such as smoking or alcohol use increase during these times of high stress. And you may also experience some other physical signs. These include sort of shortness of breath, palpitations and chest tightness. These can be particularly frightening for patients with cardiac history, and it's important to say that you should never sort of dismiss these signs altogether, and you should always talk to a healthcare professional about them. However, if you can start to gain a greater understanding of you personally, that can be helpful to identify when they may be down to sort of tension, anxiety, or stress. So there will also be psychological signs, so changes in the way that you think, feel and behave. So these can be different for different people. You may experience anger, you may feel irritable, short-tempered, quite intolerant and defensive, or you might feel quite tearful and upset. It can be normal to sort of withdraw socially during these times as well, and to feel quite hopeless. Or you might experience feeling quite numb actually, and just losing interest really in what's going on in your life. It is important to say that these signs do differ person to person, so getting to know your individual signs can be quite useful to be able to spot those developing. You will have realised that some of the sort of factors and changes that we've listed are some of the risk factors for heart disease. So things like smoking, high alcohol use, eating sugary and fatty foods. So try not to let this sort of overwhelm you, but instead think about small changes you may be able to make sort of over a period of time. So I'm going to move on now to talking about the nice positive part of how we can manage stress and deal with it. So the first step in managing stress is normally to recognise it, as we've discussed, and if possible to identify the cause. Now I say if possible because sometimes this can be very obvious if it's due to a big event or change in our life, but sometimes it might be less so. It may be due to a number of factors that have built up over time. So we might not be able to actually change the thing that's causing our stress, but hopefully we can make it easier to cope with. And it's important to focus on the things that we can actually control. Many of the things advised by your medical team at this time will also help with your mental well-being, such as sticking to a healthy, balanced diet and also sticking to recommended limits of alcohol. Exercise is also a really powerful stress reliever for a number of different reasons. So exercise can help to disperse some of the muscular tension that we may experience as part of stress. It can help improve our circulation, lower our blood pressure. It can also help to keep our weight under control, and also to help clear our mind of worrying sort of thoughts and problems that might be going on as we're doing the exercise. Exercising outdoors will also help due to sort of fresh air and the natural light. And it's also important to say that exercise does release endorphins, so feel-good chemicals into the bloodstream. So it's one of the things that is actually proven to make you feel better. Now, if you are a very busy person, and this is one of the things that's contributing to your stress, it can be really important to learn to plan and also to delegate. So this may mean learning to say no to other people, and this can be quite difficult to begin with, but remember there are times where it's really essential that you put yourself and your own needs first. The other thing that can be helpful is taking up a new hobby or finding something that you really enjoy doing. That might be something like reading, gardening, art, it can be anything. But the important thing is to schedule and make time for this. You may wish to look into using a more structured technique to help you to be able to relax. So techniques such as meditation, mindfulness and relaxation have all been proven to reduce stress levels. These techniques do tend to require practicing them regularly in order to be able to really experience the benefits that they can bring you. But there is a wealth of information regarding these tools and techniques available online, and it is well worth looking into. So there may be times when you are unable to employ your usual sort of coping mechanisms to deal with a period of anxiety, and having a simple technique, even such as a sort of breathing technique to employ in these periods, can really help to reduce and de-escalate that anxiety and stress. So as part of our rehab programme, we do practice a relaxation technique with you. Now, the type of relaxation that we normally use at cardiac rehab is something called progressive muscular relaxation. So this involves tightening and releasing each part of your body, starting from the head, working down to your toes. There is something similar called autogenic or autogenic relaxation. And this involves imagining a feeling of heat or warmth spreading throughout your body rather than the tightening and releasing. So you may prefer to try this out instead. So doing these sorts of relaxation techniques will benefit you in a number of ways. So they'll help you to really learn, obviously, how to relax your body and your mind, but also how to control your breathing and how to identify sort of different areas of tension and stress in your body and help to relieve that. So we have recorded the relaxation technique that we do with you at rehab. So you will be able to find the link for that as part of our series of videos on YouTube. So please do have a little look for that and give that a try at home in your own time. So one of the most popular and well-recognised ways to deal with stress is, of course, to talk to somebody else about it. And as the old saying goes, a problem shared is a problem halved. So you may feel it helpful to talk to your loved ones and your nearest and dearest about how you're feeling, and this can help them to understand as well. If you are struggling to come to terms with a new diagnosis, we do recommend that you do engage with rehab and with your follow-up hospital appointments, as this can really help you to sort of make sense of what's happened. There may be times where it's beneficial for you to seek some sort of further outside support and to speak to somebody who is not part of your close circle, so somebody that you don't know. So we really want to make you aware that there are services out there in the community, and these are sort of talking therapy services, they're sometimes called, and they come under the umbrella term of IAPT services, or IAPT, that's improving access to psychological therapies. Now these kind of services, it's important to say, are free of charge, and they also accept self-referrals, so you don't necessarily need to take that trip to the GP in order to access these services. You can access them over the phone or online yourself. Now, it's important to say that obviously during the current COVID pandemic, the ways in which they are operating may have altered slightly, and they are unable to offer face-to-face consultations, but there is a whole wealth of support still available online and over the phone. So the service that you will sort of fall under and be able to access will depend on where you live. So if you live within the Southampton city boundary, as it were, the service available to you is Steps to Wellbeing. So that's the word steps and the number 2 and then wellbeing. And their website, bear with me a moment just to make sure I get this absolutely correct. So their website is www.stepstowellbeing.co.uk. At the time of recording this video, they are currently offering online consultations, webinar-based group sessions, and a whole range of apps and online resources. They do also have a very helpful guide on their website for managing stress and anxiety during the COVID-19 pandemic. And there's a number of tips on well-being, working from home, also some videos around relaxation and sleeping difficulties. Now, if you live in the wider Hampshire area, so sort of around the outside of the city or out into the New Forest, then the service available to you is iTalk. And that is just the letter I followed by the word talk, sort of all as one word. And their website is www.italk.org.uk. And at the time of recording, their website says they are offering some telephone guided self-help. There's also a range of wellbeing videos on their website as well. And they also have an online CBT program which you can follow. So that's cognitive behavioural therapy. And this program is called Silver Cloud. So as we said at the beginning, we do appreciate that sometimes talking about our mental, health and well-being can be more challenging than talking about the physical side of things. But hopefully this video has helped you to think about and identify some ways you can improve your mental well-being. And it's important to say that as your cardiac rehab team, we are here to help you with all aspects of your recovery and your health after your cardiac event. So please don't hesitate to talk to us about these kinds of things as well. Okay, thanks ever so much for listening.